So first up, it's about the metapneumovirus. India is reporting its third HMPV infection case after a 2-month-old boy was admitted to a private hospital in Ahmedabad. He was found infected with this virus. And earlier in the day, the Indian Council of Medical Research, the ICMR, has detected 2 cases of HMPV. This happened in Karnataka. This came about through a routine surveillance. Now, even as these concerns are growing that the government has maintained there is no cause for alarm, the Union Health Minister has spoken as well. JP Nadda has come out with a statement and he's reiterating the same, that there is not much reason to fear. This is what he said.
ICMR, Indian Council for Medical Research और इंटीग्रेटेड डिजीज सर्विलेंस प्रोग्राम IDSP के साथ उपलब्ध सांस संबंधित वायरस के देशव्यापी डेटा को भी समीक्षा की जा रही है और भारत में किसी भी कॉमन रेस्पिरेटरी वायरल पैथोजन में किसी भी प्रकार की वृद्धि नहीं देखी गई है। हम स्थिति का क्लोज मॉनिटरिंग कर रहे हैं, हम स्थिति का बहुत नज़दीकी से जायजा ले रहे हैं और हम ये कह सकते हैं कि हमें चिंता का कोई कारण नहीं होना चाहिए। स्वास्थ्य विभाग इन सारी बातों पर नजर रखे हुए है।
So that's what we're hearing from the Health Minister. But to discuss the recent cases of the HMPV detected in India and what this could really mean for public health in the country, let's bring in Dr. Sanjeet Sasidharan. He's the Director of Critical Care at SL Raheja Hospital, which is a Fortis associate. Welcome to India Tonight, Doctor. Pleasure to get you in on this topic on ET Now. Doctor, if you can first give us a short explainer about HMPV, what this virus is, how it typically affects individuals.
Okay, the HMPV has been around for a long period of time and it is a RNA virus, very similar to the common cold viruses like respiratory syncytial virus, something like an influenza virus. It affects by actually spreading when somebody sneezes on your face or coughs violently on your face. That is when it spreads by a droplet spread to us. And the classical symptoms are that of a common cold, where a person has like an upper respiratory type infection with running nose, with sneezing, with cold, something like that. And very rarely it affects to the lower part of the lung, causing pneumonia. Very, very rarely. That's about the disease.
But doctor, now that they have detected 3 cases in India, including a 2-month-old, should we be concerned about the vulnerability of infants, young children to this virus?
So importantly, the HPME virus has been affecting our children. It has been always there. The children less than 5 years of age, in fact, are usually affected by this virus. It's only that we don't go ahead and try to detect it because it's such a self-limiting illness like any cold and cough. For that matter, if you pick up 100 children, 90 of them would have already gone through this particular illness. It's only that we don't go and detect it, prospectively. We don't go ahead and try to diagnose the entire disease because it's like a common cold. In fact, seroprevalence studies have said in children less than 5 years, almost 90% of them already have been affected with this particular virus. So yes, it can be a difficulty if the child is less than say years old, or if the person is very, very elder or is immunocompromised. But that's usual, no, isn't it? Any patient who basically has a low immunity, a low threshold to get an infection, at the same time a very elderly person or a very, very young baby will definitely worsen any time he gets any kind of infection, he or she gets any kind of infection. So I don't think there is a cause of panic in such a case.
So much comparison is being made. ICMR, also DGHS, they're making comparisons of this virus with the common cold in terms of severity, in terms of transmission. How do these compare?
So let's take 3 examples. One is the respiratory syncytial virus, the other is the influenza virus, and the third is the human metapneumovirus. Now, all of these 3 things comes with the absolutely similar symptom: upper respiratory tract of infection, common cold, sneeze, and things like that. The only difference is the time when it comes. Like the RSV comes somewhere, in the start of winters, whereas when you look at the rest of the viruses, influenza is there more or less throughout the winter, and the human metapneumovirus comes somewhere towards the midwinter and then extends towards the early summer. The only difference between all of these things is that RSV has got a vaccine, RSV has got some kind of therapy, whereas there is no licensed therapy or vaccine for human metapneumovirus.
In that case, doctor, tell us about the symptoms that we should be aware of. When should we consider seeking medical attention if we suspect this?
Right. So first of all, there is nothing to be alarmed. It's like any common cold where a person has a running nose, a choke, a kind of a sneezing condition, a throat irritation. This is how these symptoms will come with a small fever. This is how it will come. However, if by any chance it becomes to a condition where the oxygen level starts going low, your lips become blue, it is difficult in breathing, that is the time when you need to seek hospital help. Otherwise, this is clearly a self-limiting illness which actually goes and becomes okay within 5 to 7 days. But yes, blueness of the lips, difficulty in breathing, oxygen level going down, that is the time that you should consult your healthcare provider. Otherwise, symptomatically, just treatment with a paracetamol will actually do the trick.
Precautions, because Dr. Atul Goel from DGHS is suggesting some basic precautions. If you can elaborate what preventive measures we could
Yeah.
adopt to stop the spread of this virus.
Yeah, so it's very simple. We've learned it all through the COVID pandemic. One of the few things is that if you are in the age group of more than 65 years, or you've got babies less than 5 years, or you're immunocompromised, it's better to avoid crowded spaces. If somebody is sneezing, it's important for to explain to the person to actually cover the nose and mouth with a kerchief or with the elbow. It is important that if there are members in the house that are having cold cough and upper respiratory tract features, they should be kept separately from these vulnerable individuals. In short, washing your hands on a regular basis, eating a healthy diet, and drinking a lot of water would help to keep you away from all of these things, apart from the preventive strategies that I just now mentioned.
Just to prevent panic and to ensure that there is informed action about this virus, considering the current state of the healthcare system, perhaps you'd like to tell us about your assessment of the preparation within Indian hospitals to handle any potential outbreaks of the virus should the number of cases rise.
So let me give you an example. As of now, we are prepared for any pandemic. Let me put it this way: any
Okay.
pandemic, we are ready to take care of any pandemic now. Every hospital in the entire country has got wards and units that are geared to take up such cases, and we all are now so familiar with the virus that COVID has created for us that we're all prepared for any eventuality that comes in. So rest assured, you will be taken care of.
Doctor, those are very reassuring words. And of course, one always suggests that one be wary and really go with any kind of preventive care that you've highlighted as well. But routine surveillance, what does that reflect on the effectiveness of India's current health monitoring systems? If you look at what we've been able to achieve after the pandemic.
So we are not actually doing routine surveillances as of now. This particular virus does not need to have any routine surveillance per se. It's just going to add an extreme cost burden. Remember this, when you're doing tests for viruses of this nature, you need to do something called as RT-PCR. And when you do an RT-PCR, it's an expensive investigation. Now, there is no requirement to do something like this because unlike COVID, this is not really going to become a very severe kind of illness where a person requires hospitalization or requires to be put on a ventilator. So, frankly speaking, just symptomatic monitoring is all that is required. In the event that there is upper respiratory tract infection, just isolate is what is required. Nothing more than that. Wearing a mask might help those individuals who are in that age segment or who are immunocompromised from getting this particular virus.
Doctor, this emergence of HMPV in India, of course, it has raised eyebrows. The markets have also reacted, and just understanding its nature, I think maintaining vigilance, but yet calm preparedness is the key. And we've learned some of those lessons from the pandemic as well. Thank you for highlighting the importance of basic precautions, awareness without succumbing to any undue alarm. It's a pleasure having you with us to talk about the HMPV virus. We will keep checking in with you.